So this is the second part of my three-part video of my Lasik eye surgery experience. If you haven't watched part one, I just talk about the my eyes before I got the surgery and the pre and post experience and during the surgery. And in this video, I'm going to be talking about the problem that happened in my situation. So yeah. After about 3 days, I noticed that these streaks of rainbows were not going anywhere. I was still seeing these bouquets of light, like it was just like a beam of light in my eyes anytime I look at lights. And so I just would wear sunglasses a lot. It wasn't to the point where I wasn't functional, but it was definitely like at nighttime, for example, the glare was too much when I go outside. Like if there's cars that have flashlights, and we live downtown, so downtown Toronto has, like, I don't know, these billboardy flashy things. That was really distracting. So I think they asked me to come in for my post op care maybe 5 days later. I can't remember how many days, but a couple of days later. And when I came for that appointment, they said, okay, well, yeah, some people have these reactions, so what you have to do is just we wait and see. For the bouquets, there's something that can be done. So there's a procedure that's pretty normal and common that can be done to correct the sort of halo. But when it comes to the streaks of rainbows, guess what? It's super, super rare. But essentially, there were two separate situations, and both are not connected to each other. So the halo thing, like where I look at light and I see a sort of glow around the light, that's something that is like it's not uncommon is the point. So it's something that some patients report having post surgery. But then the one where I see streaks of color is completely rare. And actually my surgeon told me that up until a few years ago, meaning like 5 years ago or something, when patients came back and said they saw rainbows, they used to be told that they used to be referred to a psychiatrist. that's how crazy that is, because they just couldn't explain why that was and stuff like that. So basically the plan was, let's just wait and see if everything subsides. My surgeon was hesitant to do anything about the second rainbow situation. So like the rainbow streaks, he was like, he's never done that surgery before, and so he was just telling me that somebody else would likely have to do it, who's like in Canada, they've probably not even done it. I think they've done one of those surgeries before, and so but the other surgery he can do it and it will be fine. Okay, so I think I had to wait until maybe 2 months or 3 months later. I came back in December, and at the time I was probably going to get ready to do my halo surgery, except when I got there, I told the doctor that I was pregnant, because I just found out that I was pregnant. And so he said that, yeah, like we can't do anything about it now. We just have to wait until after I give birth, and after I've stopped breastfeeding and such, so that we can revisit the situation. In the meantime, we'd hope that things will correct themselves, because sometimes they do. So with both the rainbows and with the sort of light glow thing. The other thing that he told me too at the time was that when women are pregnant, well, obviously women are pregnant anyway. When people are pregnant, they, like women, we obviously, because of the hormones, our eyes actually go in a weird state during pregnancy. So some people actually maybe start wearing glasses because they're pregnant, or they stop wearing glasses. Like it's just like your body acts in a way that affects your eyes apparently. So that was another factor that was added to the situation. I think I forgot to mention when I did the first part of the video that when you select your plan for surgery, you can actually pick, I think you pay a little bit more to get an annual lifetime checkup or something like that and correction, or you just pay the standard fee and then you don't get to, like, anytime something bad happens to your eye, if something bad happens, you'd have to pay it out of pocket. Whereas like if you pay a little bit more, like $1,000 more or whatever it is, like for the rest of your life, you can, I don't know, every year you have to just come in and get it checked and blah blah blah. So obviously I picked the one which is the insurance option, like, which is you know, you have it covered if something happens, but you have, the deal is you have to come in every year to keep that going. Anyways, so that's what I did. So for the next 2 years, when I was pregnant and then I gave birth and was raising my boy, I kind of didn't do anything with my eyes. Like, I went in for my checkup, I think once in between that point, and then after that I just did, I mean, yeah, I just was waiting until I stopped breastfeeding, which I just recently did. So yeah, so during that time my eyes pretty much stayed the same. However, I think I got used to both the glow and the rainbows, so I still see, like, I was still seeing them every day. I don't know if it was because I wasn't also driving, so it doesn't affect me, or I was mostly at home, I don't know. But point is that it wasn't as dramatic as it felt the first, I don't know, month or something like that. Let's fast forward to the next video. In the next video, I will tell you where I'm at now with my eyes and what I think about the overall experience if I would do it again.